Carrie Tehran, founder and CEO at Healing to You in Southern California. For over 20 years, Carrie has worked in a clinical capacity as program director for community mental health agencies serving children and their families exposed to abuse and trauma. Healing to You is seeking $750,000 for a one-year bridge to grant loan. This investment closes on August 21st. Carrie, welcome. Please tell us about Healing to You and what are you working on? Beautiful plants, by the way.
Thank you, Vivian. Hopefully you all can hear me okay.
Yes.
So we are a new nonprofit. We were founded in 2022. I have 25 years of experience in mental health services, community mental health, program development, and implementation. I started as a clinician and started with domestic violence organizations as a young intern, and in the 90s ended up developing one of LAPD's first emergency programs, programs of emergency response that partnered with a domestic violence shelter in Santa Monica. And we had advocates who would kind of partner up with police officers and UCLA emergency room, and we would be able to respond to calls to be able to secure services, help a victim and her children to get into shelter or hotels, and connect with legal resources. So I'm quite familiar with implementation of new programs. After I was working in the domestic violence shelters, I realized I needed to finish my hours for my clinical license and dove into clinical work and ended up overseeing some programs for school-based mental health community agencies. And throughout 20 years, ended up seeing the same types of cases, a lot of domestic violence. I have specialties in children's sexual abuse and child abduction, reunification, recovery. I am part of the California Child Abduction Task Force under the governor's office. And through that appointment, I became aware of a grant, a significant grant, to provide medical services and COVID testing to domestic violence shelters. The grant was through the American Rescue Plan, and so the dollars have trickled down to the state. We wrote the grant last fall, and in April, we were notified that we were awarded the service area for San Diego County, Orange County, and Riverside County. So we are the official domestic violence mobile medical and mental health services for those three counties. The total grant is just under 6.9 million. And our only hiccup is that it's a reimbursement only grant. And so we've got a very large pot of money to spend down from, but we have to spend some money and earn some or fundraise some money to be able to pull down from that pot. So what we have designed for this program is to serve three counties. We have two 38-foot mobile health clinics, and each mobile health clinic has 3 rooms. So there's an initial waiting room that our residents, patients can enter onto the clinic. And then we have a medical assistant and a site coordinator that can help transition patients, take vital signs, things like that. We have a nurse practitioner in one room who provides all of our medical care, and that includes adult and pediatric primary health care, COVID-19 testing and vaccines. Because we are working with domestic violence, we also provide injury documentation and forensic exams, which is a specialty that can be hard to come by. We do rapid testing for glucose, cholesterol, A1C, hemoglobin, and pregnancy. We do EKGs, vital signs. prescription medication. One of the challenges with domestic violence shelter residents is they might be fleeing an abusive situation and unable to take their antidepressants or their medication. So our nurse practitioner, can make sure that there's consistency with prescription management. We provide school physicals and pediatric immunizations. A lot of times when residents are in domestic violence shelters, even though the stay is only 30 to 45 days, the children still get enrolled in the school that's nearby. And oftentimes they need an updated school physical and vaccinations. So that is a big service gap for domestic violence shelters. And we're very happy to fill in gaps that are needed. Our third room on the bus provides a children's therapeutic space where we have a licensed mental health clinician who can provide different levels of mental health services based on what the domestic violence shelters need. We don't want to step on any toes, but some shelters don't have any mental health support, and other shelters might have one licensed supervisor with some interns. So we want to make sure that we are working collaboratively with the shelters. And if they only need what I call mental health light, where we're just providing a supportive environment while folks are in transition. So if the parent is getting a medical exam or maybe some injury documentation, that we have mental health clinician that is there to play with the children, help them process their feelings, or just regulate some anxiety that they might be feeling as they're transitioning. Our mental health specialists are also trained in early childhood development assessments and screenings. So one thing that we notice is families who are living with domestic violence are not seeking out regular medical appointments or pediatric care due to the coercive control in the relationships. And so these residents in shelters are often lacking in preventative healthcare or early childhood developmental screenings. So an infant or toddler might be maybe falling behind a little bit on either physical development and coordination or social emotional development. And so this population of domestic violence survivors are very overly exposed to trauma, as well as lacking in healthcare services. So they're at a greater risk of having long-term chronic health issues. So we feel like this is a major important service that is severely lacking. My experience in the shelters from the 90s and early 2000s, as well as from what I'm hearing still currently, is that when a resident goes to a shelter, they go through the intake process. A lot of times they're coming in and maybe their child has an ear infection, or maybe they haven't had a COVID vaccine and they need one. Maybe their abuser has not allowed them to go to the doctor, and so now they've got to follow up with some things. Oftentimes, the residents have to go to the local urgent care or emergency rooms. And if you've ever been into an emergency room, you know that can take 10 to 12 hours sometimes. And for a family leaving sometimes a hostage-like situation where everything is controlled, every movement, every phone call, to have to sit 12 hours in an emergency room with so much trauma around you can be really stressful and more traumatizing, but also opens up the shelter for more virus and illness risk, because then the family is exposed to whatever's in the emergency room and they're bringing it back to the shelter. So when we first heard about this grant opportunity, we thought this was a dream, and what a wonderful way to be able to provide even more. The grant was initially for just a COVID testing and vaccine clinic, but I thought, I can't roll into a shelter without mental health services and without these developmental screenings. So since we've even written the grant, we've conceptualized even more. We want to make sure that we have infant massage education. I'm a certified infant massage educator and a specialist in 0 to 5 mental health. So I've worked with foster children, infants and toddlers, and helped them work through their trauma. And using child parent psychotherapy, which is an evidence-based psychotherapy treatment model, it is a wonderful modality to use with young children and adults who are living in domestic violence shelters. Our long-term goal is to stop the cycle of violence. And we're hoping that with early intervention services and filling in some gaps and meeting the needs of these survivors, that we're hoping that maybe they won't go back, or that they might be able to start a fresh start, and that maybe the children won't continue the cycle and make some different choices in their relationships. We also partner with a couple other of our nonprofits friends. We partner with the Joyful Child Foundation in memory of Samantha Runyon, and they put on brave safety and empowerment workshops. And so they're putting together a specialized lesson for us that we can play like a video that is specific for domestic violence. In child abduction, 95% of all children missing are parental or family abduction. And 100% of those cases involve domestic violence. So we have a unique opportunity to impact and hopefully prevent any future parental abductions by being able to provide this information through workshops with our families. We also partner with Power of One Self-Defense Institute in Long Beach, and they provide safety and empowerment workshops for our staff and the residents, where they come out once a month, and we set up space. And one of the local shelters might help us with their conference room, and they provide not necessarily self-defense, but just more empowerment. How can we stand in our power, use our words, say no? And they also figure out like safe words in case they're with their abusive parent, or have exposure to them and they need to reach out to their safe parent. So what we are asking for, like I said, we have almost 6.9 million sitting waiting for us. Our mobile clinics are in the process of being built by Mission Mobile Medical, and they had so much faith in us that they started this build without their usual down payment. So our mobile clinics are costing us 1.4 million, and typically they would have us do 400,000 down, and they waived that, and it's in the demo process right now. I just got pictures yesterday. So it's very exciting. And so we are looking for a bridge loan, to help us pull down from our grant expenses and also put a down payment to our mobile clinics, because they've been so amazing in having faith for us. We have an anticipated launch date of October 1st. So our mobile clinics have a delivery date of September 15th, and we're really hoping to get them a down payment before we get delivery. And then for next year, we plan on applying as a federally qualified health center, which would enable us to apply for some Human Resources Services Administration grant funding for sustainability. And we would also be able to get free vaccines, which would save a lot of our operating expenses under our vaccine line item.
Thank you, Carrie. I think just from talking to you, I've learned a lot. I mean, we probably all have some basic knowledge about the challenges of mental health services, and you add on the fact that these families may already be not in their permanent residence, and the the flexibility that need. So this mobile unit is a newer concept, right? And are there other mobile units out there?
There are some mobile healthcare services out there, but there are no, we are the first mobile healthcare provider specifically for domestic violence shelters in the state of California. And so there's no other program like us. Um, because shelters are typically in residential areas, they're a home just like any other house. We didn't want to drive a 38-foot recreational vehicle into the neighborhood. So our service delivery plan is to park. We've partnered with a few police departments, or in some cities, it's the CHP that provides us shore power through the day so that there isn't that constant hum on the medical clinic as they're all working. And so the clinic parks at a different location each day. We rotate through our 3 counties, and we operate 6 days a week so that we can maximize our ability to see patients. And so the clinic parks at its designated location for the day. And then we have a passenger van, a hybrid Toyota Sienna, that our site coordinator drives to the shelter and transports the group of residents back to our clinic, and essentially acts as their Uber driver for the day. So they do a few pickups, and we anticipate being able to serve 15 patients on each clinic per day. And again, we operate 6 days a week, and we hope to be able to serve 8,640 patients that way per year.
Wow. Wow. That's awesome.
Mhm.
Well, it's awesome that you serve them. It's not awesome that we have numbers of
True.
that magnitude. Um, Earlier you mentioned something about the grant reimbursement. I think just for the benefit of everyone, they're not alone, even despite this endorsement basically by the government awarding them close to $7 million in grant over 2 years. It is on a reimbursement system, which is oftentimes how government grants work. So Lendonate, we found that we really partner very well with nonprofits, providing them the initial capital to start spending, and then the reimbursement, therefore the use of, I should say, the source of repayment is from the grants when the reimbursement's received. Maybe just as a final note for investors who are not familiar with this reimbursement system, how quickly do you get reimbursed?
Yeah, we get reimbursed 30 to 45 days. So we submit our expenditure reports at the end of each month, and their California OES, the Office of Emergency Services, our funders, they anticipate a 30 to 45-day return.
Great, good to know. And then maybe I'll just ask you an open-ended question before we part. What would be a takeaway you would like potential investors to have? You've shared so much details, and I know personally I've learned a lot from our conversations. What's maybe one takeaway you would like everyone to have?
Oh gosh, just one. Well, I think that this is a desperately needed service. As I've been connecting with shelters and speaking with their executive staff, they are floored with what we have put together, and the feedback that I've gotten is, "Oh my goodness, thank you so much! I can't believe someone's finally done this." Um, and I'm proud, but I'm also kind of saddened that for the last 20 years, shelters have continued to struggle. I kind of figured, well, of course they've figured this out, but I guess there just isn't the money for healthcare providers and shelters. And so I'm so grateful for this grant opportunity, and that Cal OES even thought of this idea, and grateful to you all for hopefully helping us out in launching our little program that I hope will be statewide someday.
Obviously, yeah, that actually answers, I think, partly a question that's in the Q&A that someone asked if you can repeat the 3 counties you currently serve in, and then the
Yeah,
follow-up question is, where do you see yourself next in California?
yeah. Our 3 counties are San Diego, Riverside, and Orange County. Um, in talking with the unit chief of our grant division, this is a one-time funding opportunity. However, if they see benefit, they can choose to extend or create a new RFP for us to write for. And so they have a lot of faith in us, and we would like to see ourselves expanding to other counties as well, maybe slowly moving up the coast. I'm very familiar with a lot of domestic violence agencies in LA County. And so as I was doing this research for this grant, I had reached 12 out of the 20 shelters in LA County, and they all wanted our services. And so
Mm.
I said, okay, you've got to hold on. I've got to do these 3 counties first.
Well, mobile units have wheels, so
That's
I can
right.
see,
Yep.
I can see the demand. Thank you
We'll
so
get
much for
more.
spending time with us and sharing your insights. If we have more questions, from our attendees, we'll reach out to you, Carrie. Thanks again.
Wonderful. Thanks, Vivian. Thanks,
Thank you.
everyone.
Good to have you.